I think maybe transitioning to the personal protective equipment issues, because I've seen on Facebook and had questions about, do we have enough masks and so forth to keep our staff safe and keep them doing their jobs and taking care of patients. And so we've taken a lot of measures, extraordinary measures, things that none of us in healthcare would normally do to try and preserve and conserve our PPE. We are also looking at recycling. We are recycling masks. As of last Friday, our entire organization, all our employees, our medical staff, visitors are required to wear a mask. But there aren't enough really around the world. There aren't enough masks in the supply chain right now, whether you're talking about a simple procedure mask or an N95 respirator. There aren't enough of them. So what we've done is lower acuity or less risky positions, like mine, for instance, in administration. I've gone, and all of my colleagues have gone to wearing a homemade cloth mask, and that's based on our job, and our medical staff has looked at all the jobs in the organization. This was a monumental task. They looked at all the jobs in our organization and stratified those according to risk levels. And so it turns out the CEO is in a lower level risky job, but our ICU nurses and frontline physicians and caregivers are obviously higher in that risk level, so they wear a better mask. And we're trying to conserve our inventory by doing things like that. We also are recycling those masks. We have found a way, and Dr. Barabbas can explain this a little better, but we found ways to properly sanitize, clean those masks, and so we're reusing them. And we're doing the same thing with other parts of our PPE in an effort to utilize them and utilize them very conservatively, because as you've no doubt seen in other parts of the country, they're very, very difficult to get replacement for some of these supply items. So I don't know, Dr. Barabbas, you want to talk a little bit more about that and what we're doing there and how we're doing it?
Yeah, absolutely. This is a big concern for everyone. It was just announced today that the strategic national stockpile is now empty, and so we realized that was going to happen, and that us being sort of lower along the surge timeline, that we would less likely have an opportunity to get much from them. So we've done a lot of research looking at different ways how to prolong the use of our PPE. There's two different methods. One is to wear it for a longer period of time, and then number two is to also then recycle the PPE that we have. We essentially have three types of masks that are broken down: cloth, surgical mask, and then the N95 respirator. These are all used for different levels of protection. The cloth mask is essentially to help protect other people from the wearer of the cloth mask. It is not used in patient care, so none of our nursing staff or our physicians will use a cloth mask when they're directly interacting with patients. The minimum requirement there is to have a surgical mask. And then for those that are in close contact with high-risk patients or doing procedures that can increase the chance of spread of virus, such as intubation, then they will use an N95 respirator. Because these are not limitless pieces of equipment, we have done a lot of research and looked at other institutions like Duke, Stanford, University of Nebraska, that have come up with different protocols as to how to clean the equipment essentially and sterilize it so that we can reuse these very valuable resources. So we have a couple different methods here at our hospital. One is hydrogen peroxide vaporization. It's essentially a sterilization machine that we use for other surgical equipment that has been shown from outside studies to disinfect the N95 respirators and the surgical masks, so that when they are cleaned, they're essentially sterilized and ready for reuse. They do have limited use of life, just because eventually equipment does break down, but it has been shown that we can at least recycle these potentially even dozens of times in certain cases. We're very careful that we look at the equipment to make sure it's still, that these masks are still usable and functional, and if they are not, then they're discarded, and then we go through the newer masks that we have. We also use, we don't use it, but we have the availability of using UV radiation, which has also been shown to be good at sterilizing masks as well if we needed to. A lot of this will be dependent on how fast and how quick we use our PPE based on the number of patients that we have. So we really feel like we've gotten this down essentially in terms of how to recycle the PPE, both in collecting it, cleaning it, and then redistributing it to our employees. So we feel like none of our employees have to be at risk whatsoever, and that our stockpile essentially here should easily be able to accommodate the number of patients that we expect to see.
We've also, I think, have been very impressed with our community early on, and really it hasn't stopped. We've had donations of N95 masks and Tyvek suits, and Harbor Freight recently this week gave us 2 pallets of PPE, including N95 masks and gloves and so forth. So the outpouring from the community, including the industrial part of our community, has really been appreciated, and I don't even know how to say thanks enough. People have given of their own inventory, and I mean donated, given. We haven't had to pay for it. We have sourced around the country for additional PPE, and so we continue to get some through our supply chain. It's just greatly reduced from what we would normally get. So we feel like, in terms of planning and preparation, that we have adequate PPE for what we foresee coming our way. And with the conservation and recycling methods that Dr. Barabbas talked about, we think we're in pretty good shape from that perspective.